My name is Jenny Sentongo. I'm the Learning Disability Clinical Nurse Specialist based here at Queen Elizabeth Hospital. So our role, we work, like Amy said, we work closely together. It's ensuring that people coming into hospital with a learning disability who may have additional communication needs or support needs are supported adequately, making sure that the journey is smooth for people coming into hospital and people understand their care, making sure that carers and families are involved in that process as well and they receive the appropriate support, just to make the journey short and less stressful. So we generally get referrals across the board really. So it might be somebody with a learning disability who's known to the learning disability services, or it might be somebody with a learning difficulty who's known to social care, for example. And it's across the range of people with autism as well. We get those kind of patients. But it's generally around supporting on the wards. The staff may ask for support around communication aids, for example, supporting that person to understand their care and the pathway. It might be issues around managing behaviours that are difficult. Obviously being in hospital is stressful and distressing, so somebody may be really frightened, so we might get support, asked to provide some support. You know, it's challenging enough for all of us, just trying to work out which area you need to be, understanding where you need to go for a particular investigation, and just having information that's accessible, that allows people to make a choice, to make decisions about how they want to be treated, and being involved in the processes around making decisions about care, capacity assessment, that sort of thing. When we get the referral, we go in and we make sure that the person is feeling safe and comfortable. We make sure that person is able to understand the care and treatment, and the carers are involved in that process, and that the wards or the departments are aware of that person's additional needs. So we're here for the patients, we're here for the families, we're here for the carers. And obviously we work in partnership jointly with Lewisham. We also work very closely with the community team. So when somebody comes in hospital, just kind of making sure that we join up as early as possible, just to make sure there are no gaps up to the time when that person is discharged, to make sure there's continuity when somebody leaves the hospital.
Hi, my name's Louise Stockdale. I'm a complex physical health nurse at CLDT in Greenwich, the Community Learning Disability team in Greenwich. So our role and our links with the hospital would be if somebody was admitted with a learning disability, they might already be on our own caseloads, or they might just be on the register at Greenwich CLDT, and we would then link in with Jenny, Hospital Liaison nurse, to ensure that all of the reasonable adjustments are made, so that they can have a smooth hospital visit. So the hospital pass month is a document that we give to all of our service users, which can be completed by friends, family, themselves. We would help them complete it if need be, and it's a 3-page document which goes through the things we really need to know about a person, the things we definitely need to know about the person, such as, say, example, communication, how the person communicates whilst in hospital, and their likes, their dislikes, so that when they're in hospital, the hospital staff can read it, and it's a really quick and really quick way of accessing really important information about the person. We would usually find out if somebody was admitted to hospital through Jennifer, or perhaps by the clients themselves if their families or whoever has told us. And then our initial conversation would be with Jenny, and we would then have a conversation about how to support that person best in hospital. It might be that we know them, we've got prior knowledge of them coming into hospital. It might be that they're completely unknown to us, and then we'd have a discussion about what would be best for them in hospital. So it's similar really. Some of our service users might not just come to QE, they might go to the Lewisham Hospital too, in which case we'd tap in with Emma.
My name's Emma O'Donnell. I'm the Learning Disability Clinical Nurse Specialist. I work at University Hospital Lewisham, and I work under the safeguarding team. I cover Lewisham Hospital, but we work closely to develop pathways to provide reasonable adjustments for people with a learning disability when they access the hospital, and we also provide training for all staff. So we have a lot of training that we're rolling out to all staff in all areas and departments, and we also have learning disability champions who we've just done some training for, so we're hoping that will be a more robust support network for those patients accessing the services. We are definitely working really hard to get all those pathways, and also developing a policy which will be for the trust, so everyone accessing the hospital will have a really clear idea of the staff will know exactly what their role is.